So I'm Simon Burall. I'm Director of Involve, which is one of the 4 organisations delivering NHS Citizen for NHS England.
Can you tell us why we're here in Birmingham today?
Well, we're here because we're kind of 12 months into designing NHS Citizen, and we've been very much focused on how does the national NHS Citizen work, and how is it going to feed into national decision-making processes within NHS England. But we know that most citizens experience their healthcare at local level, that most of the problems and challenges and successes are at the local level, and but there's also lots of good participation going on at the local level. And the question is there a role for NHS Citizen? And if there is, what's that role in supporting the action that's happening already to help to nurture and create local conversations, and then to work out which to feed up to the national level, to the board of NHS England?
And today, how are we starting that conversation? What are we going to actually discuss in practice?
So we're going to start, so it's a 2-day, 1.5-day workshop. So this afternoon we're going to focus with who's in the room, who have we got in the room, who's missing in terms of sectors and organisations and individuals. And then we're going to start looking at the real problems that people are facing with health and social care at the local level. And then we're going to look at, well, what would a successful health and social care system look like in 10 years' time, being realistic, not idealistic, and then begin to really bury into the problems that people face and begin to say, well, what would need to change, and is there a role for NHS Citizen to make that change? And then this evening we've got some kind of, for people who want to stay, some other activities going on, which I can tell you about in a minute. And then tomorrow we're going to be looking at NHS Citizen itself and saying, given the conversation yesterday, what do we need to change about the design of NHS Citizen as it is at the moment in order to make it useful for local level conversations, to make sure we're not kind of getting in the way of what's working already. And then finally looking at what sort of support is NHS Citizen going to have to offer, both nationally and locally, to actually make all this work.
And what's that going to influence immediately? Are there outputs from this event?
So we're right now in the stage of developing, finalising the design and developing the prototype and writing what NHS Citizen will look like, and this will fundamentally affect what goes into that. So we had the NHS Citizen Assembly meeting test 2 weeks ago, and we've learned an awful lot from that will change the design of the Assembly meeting. We've broken the Assembly meeting model 3 times now, and we fully expect to break bits of the gather process and bits of discover, and in breaking it and asking why that wouldn't work, we hope to be able to design something that is better able to deliver what citizens in particular need from the NHS.
Thank you very much.
Thank you.